All right, let's talk about renal anatomy. I know, it can feel incredibly dense, super complicated, but the goal today is really simple. We're going to make this entire neighborhood around the kidney feel way more familiar and honestly, a lot less intimidating.
And that's exactly what we're going to do. Think of it like unfolding a complicated box. We're going to look at each flap, each fold, one piece at a time. And by the end, you'll see exactly how it all fits back together. No problem.
So, here's the game plan. First, we'll get the lay of the land, the kidney's neighborhood. Then we'll look at the fences and borders that separate everything. After that, we'll dive into some kidneys that look kind of weird but are actually totally normal. We'll even tackle the strange case of missing kidneys, and finally, we'll see how all this stuff actually looks on a CT scan.
Okay, first stop, the kidney's neighborhood. You know, before we even get to the kidney itself, you have to understand the space it lives in, the retroperitoneum. Getting this basic geography down, it's the foundation for literally everything else we're going to talk about.
And here's the most important thing to get right off the bat. This whole area is split into 3 main compartments. And this is not just some random anatomy trivia, okay? This is exactly the kind of high-yield stuff that those classic point-the-arrow exam questions absolutely love. So what's actually in these spaces? Well, let's start from the back and move forward. The posterior pararenal space, super simple. It's basically just fat. Easy enough. Move one step forward and you're in the pararenal space. This is the kidney's own little apartment, right? It's got the kidneys, the adrenal glands, and the top of the ureters. And then, all the way at the front, you have the anterior pararenal space. That's where you'll find parts of the pancreas, duodenum, and the colon. See? It's a really organized layout.
All right, so we've got the spaces down. Now, let's talk about the property lines. I mean, these spaces aren't just floating around in there. They're separated by these thin but really distinct layers of tissue called fascia. Think of them as the fences of our little neighborhood.
And this slide lays it out perfectly. If we take a slice and look from front to back, the first thing you hit is the anterior pararenal fascia. Next up, you've got the famous Gerota's fascia, which actually has 2 layers, an anterior and a posterior one, that kind of wrap around that perirenal space we just talked about. And finally, way in the back, you've got Zuckerkandl's fascia. Knowing this order is so key because it helps you understand how things like fluid or an infection might spread, or more importantly, how they get contained.
Okay, so we've mapped out the normal neighborhood. But what about the houses that look a little different? Now we get to the fun part, common anatomical variants. These are the kinds of things that can really look like something serious is going on, but are actually completely, totally harmless. First on our list is the dromedary hump. It's just this focal bulge you sometimes see on the side of the left kidney. And why the left one? Because its neighbor is the spleen. Over time, the kidney just kind of molds itself around the spleen. It can definitely look like a mass at first glance, but its classic location and smooth shape are dead giveaways that it's just a normal, quirky variant.
Here's another classic mimic, a hypertrophied column of Bertin. So, what happens is a piece of the outer kidney tissue, the cortex, dips way down into the central collecting area, which is called the renal sinus. The absolute key to identifying it is on a scan. This tissue will light up with contrast exactly like the rest of the normal cortex. And that's how you know for sure it's not a tumor. It's just normal tissue hanging out in a slightly unusual spot.
Oh, this next one is a huge source of confusion. So sometimes the bumpy shape of a baby's kidneys just sticks around into adulthood. The hard part is telling that normal fetal ovulation apart from actual scarring. But here's the critical difference. With fetal ovulation, the little dips, the indentations, they lie between the pyramids. With scarring, the indentation is directly over a calyx, one of those little cups that collects urine, and that calyx will often look all blunted and deformed. It's a subtle difference for sure, but it's a vital one.
Okay, let's switch gears. We're moving from kidneys that look a little weird to a much more dramatic situation. What happens when a kidney isn't there at all? This is called renal agenesis, and it leads to some very predictable and very serious consequences.
So renal agenesis just means you're born without one kidney or both. Now, if it's unilateral, meaning just one is missing, a person can live a totally normal, healthy life. But when it's bilateral, when both are absent, well, that sets off a very severe and predictable chain of events.
And that chain reaction has a name, the Potter sequence. Let's just walk right through it. If there are no kidneys, the fetus can't make urine. And it turns out fetal urine is what makes up most of the amniotic fluid later in pregnancy. So no urine means not enough amniotic fluid. And that fluid is absolutely critical for the baby's lungs to develop properly. Without it, The lungs stay severely underdeveloped or hypoplastic, which is ultimately fatal.
You know, even when only one kidney is missing, it's rarely an isolated thing. It's very often linked with other developmental issues, especially in the reproductive system. Get this, for women, up to 70% can have genital anomalies, like a unicorn-weight uterus. For men, about 20% might have things like an absent vas deferens on that same side. That's a really important clinical connection to keep in mind.
So how can you tell on a scan if a kidney has been missing since birth versus, say, being surgically removed? This slide shows us the secret, the pancake adrenal sign. Normally, the adrenal gland sits right on top of the kidney, which molds it into this nice little Y shape. But if the kidney was never there to begin with, the adrenal gland just flattens out, looking like this long, flat pancake. It's a really cool, really elegant radiological sign.
All right, for our last section, let's pull all this anatomy into the real world of clinical imaging. We're going to look at how we actually visualize the kidney using the different phases of a CT scan. This is where it all comes together.
So when we do a CT scan of the kidneys, we usually inject an iodine-based contrast into a vein. And the single most important thing to understand is that what we see on the screen depends entirely on when we take the pictures after that injection. The kidneys process and get rid of this contrast in a very predictable way, and we use that timing to our advantage.
This table breaks down the 3 key phases. First up is the corticomedullary phase, which happens at about 30 to 40 seconds. Here, the contrast is lighting up the arteries and the outer cortex of the kidney, making it perfect for checking out blood vessels. Then we wait a bit, until about 100 seconds, for the nephrographic phase. Now, the contrast is soaked into the entire kidney tissue, making it all uniformly bright. This is, hands down, the best phase for finding renal masses, because tumors usually don't light up as much and will stand out. Finally, after a few minutes, we hit the excretory phase. The contrast has been filtered and is now in the collecting system in ureters, so this is the perfect time to look for things like urine leaks or blockages. So there you have it. We've toured the neighborhood, we've looked at the fences, we've met some of the weird neighbors, and we've even learned how to take pictures. We've covered a ton of ground. But the real question is, after seeing how it all connects, which one of those subtle findings, that weird but normal variant, or maybe the sign of something missing, which one do you feel like you could spot with confidence now? Really think